That's good news, but we need to go faster. That's why I'm taking steps on vaccination requirements where I can. Already I've outlined vaccine requirements that are going to reach millions of Americans, federal workers and contractors, medical staff caring for our veterans at VA hospitals, and our active duty military reservists and National Guard. Today I'm announcing a new step. If you work in a nursing home and serve people on Medicare or Medicaid, you will also be required to get vaccinated. More than 130,000 residents in nursing homes have had, sadly, over the period of this virus, passed away. At the same time, vaccination rates among nursing home staff significantly trail the rest of the country. The studies show that highly vaccinated nursing home staff is associated with at least 30% less COVID-19 cases among long-term care residents. With this announcement, I'm using the power of the federal government as a payer of health care costs to ensure we reduce those risks to our most vulnerable seniors. These steps are all about keeping people safe and out of harm's way. If you walk into a government office building, you should know that federal workers are doing everything possible to keep you safe. If you're a veteran seeking care at a VA hospital, you should not be at a greater risk walking into the hospital than you were outside the hospital. And now, if you visit, live, or work in a nursing home, you should not be at a high risk for contracting COVID from unvaccinated employees. While I'm mindful that my authority at the federal level is limited, I'm going to continue to look for ways to keep people safe and increase vaccination rates. And I'm pleased to see the private sector stepping up as well. In the last week, AT&T, Amtrak, McDonald's, they all announced vaccine requirements. I recently met with a group of business and education leaders from United Airlines to Kaiser Permanente to Howard University. We're also doing the same thing. Over 200 health systems, more than 50 in the past 2 weeks, have announced vaccine requirements. Colleges and universities are requiring more than 5 million students to be vaccinated as they return to classes this fall. All of this makes a difference. The Wall Street Journal reported the share of job postings stating that new hires must be vaccinated has nearly doubled in the past month. Governors and mayors in California, Maryland, Massachusetts, New York, Oregon, and Washington have all announced vaccination requirements. So let's be clear. Vaccination requirements have been around for decades. Students, healthcare professionals, our troops are typically required to receive vaccines to prevent everything from polio to smallpox to measles to mumps to rubella. In fact, the reason most people in America don't worry about polio, smallpox, measles, mumps, or rubella today is because of vaccines. It only makes sense to require a vaccine that stops the spread of COVID-19. And it's time for others to step up. Employers have more power today to end this pandemic than they have ever had before. My message is simple. Do the right thing for your employees, consumers, and your businesses. Let's remember, the key tool to keeping our economy going strong is to get people vaccinated and at work.